started.
We're going to move on. Yes. Good morning, everyone. It's my pleasure to introduce our third panel for this morning. My name is Brian Duke, and most recently I served as Secretary of the Pennsylvania Department of Aging. Pennsylvania is the fourth grayest state in our country, and we served over 1 million Pennsylvanians, providing everything from information referral to in-home support. And previous career consists of opportunities in the field of aging as well as hospital administration, so it's a pleasure to be with everyone today. It's also my honor to introduce our panel this morning. The panel is going to be speaking on Beyond Race and Ethnicity, additional issues of diverse populations. And most certainly when we think about diversity, we can think about the populations that we'll speak about today. The unique experience of the male caregiver, the experience in our rural communities, and the experiences that are experienced in the LGBT community. And with us today are three people who will help us in that regard. First person who's with us is Winston Green. Mr. Green was born in Queens, New York, is married to Pansy. He married her, he says, at an early age, and now has been married for 59 years. And so, Mr. Green, he's also the parent of 3 daughters and 6 grandchildren and 2 great-grandchildren, and they reside in Valencia, California. Spent his career, as did his wife Pansy, working for Rockwell Boeing, both retiring after 41 and 35 years, respectively, of service to that company. 5 years ago, Pansy was diagnosed with Alzheimer's disease, and Winston has become her primary caregiver. And today we'll share that journey of the disease one day at a time, and we'll learn about his aspects of patience and understanding so that we can better understand the role of the male caregiver. Mr. Cliff Bird is with us today from the Georgia Division of Aging Services. Mr. Bird has worked in the field of gerontology in Florida and Georgia. He is currently caregiver specialist with the Georgia Division of Aging Services, where he coordinates the caregiving initiatives, including special grants and education and training activities and special projects, some of which you'll hear about today, like a mobile day program and a caregiver focus group, which has helped to develop state reports, and kinship care services for grandparents helping to raise grandchildren, and congregational respite, and many others. Mr. Burt has served in many roles in aging services, including Alzheimer's disease coordinator for the Division of Aging Services and others. And we also welcome Dr. Karen Fredrickson Goldson, who's professor and director of Healthy Generations at the Hartford Center of Excellence at the University of Washington. Dr. Fredrickson Goldson's primary area of scholarships in the intersection of health disparities and aging in marginalized communities. She's the principal investigator of Caring and Aging with Pride, a national study, the first national study of health disparities of the LGBT, midlife and older adults and their caregivers, and the continuation project that's continuing. Dr. Frederick Goldson is leading the first longitudinal study on health, aging, and well-being among LGBT, midlife, and older adults to identify modifiable factors that can help with health trajectories over time in these communities. And so we welcome you, Dr. Fredrickson Goldson, to the panel as well. Following the example of the other panels today, each of you will have 10 minutes to address the audience that's gathered here, and then we will have an opportunity for questions and answers. So why don't we first start, if we're comfortable, we'll start with you, Winston. Thank you.